The World Health Organization states that children are more vulnerable to environmental risks due to the fact that they are constantly growing. They breathe in more air than adults do, they take in more food and water than adults do, just generally in proportion to their body weight. They also have little or no control over their environment, and their bodies are still developing. Health problems can occur due to exposure to biologically contaminated water, poor sanitation, as well as indoor air pollution. Indoor air pollution can be caused by cooking or heating with wood or coal due to them being potentially contaminated with health-damaging pollutants. This is also poor indoor air pollution is also caused by smoking, whether that be secondhand or firsthand smoke, because a lot of adolescents are already smoking. So there's constant evidence that the exposure to indoor air pollution leads to acute lower respiratory infections in children, and later on in their adult lives it can lead to COPD and cancer as an adult. As nurse practitioners, we need to make sure we're educating our parents as well as our adolescents on heating or cooking with safe products, as well as smoking cessation programs, not starting to smoke, smoking away from other children, or not in the car with children. We should encourage them to either quit smoking or to not even start smoking to begin with. This includes using vapor cigarettes. More and more studies are being done on the risks of using the vapor cigarettes, and studies are finding that those are just as dangerous, if not more dangerous, than regular tobacco smoke. Indoor air pollution can also be caused by allergens such as dust, pollen, animal dander, cockroach particles, mold, and lead from paint, whether that be paint on toys or just paint off the wall. These can lead to serious health and lung conditions, as well as even seizures. Education and prevention is key when it comes to these things. We need to make sure we eliminate or decrease exposure. As primary care providers, when we're nurse practitioners, we need to make sure that we're doing lead screening on children as recommended, because a lot of times they're asymptomatic when they're initially having lead poison. In the state of Kentucky, they recommend that we do lead testing on children at 1 year and at 2 years. And children between 25 and 72 months old who haven't already been screened should be screened. The guidelines also state that we should do this with prenatal patients if they meet risk criteria that is found on the Kentucky website. This includes just a overall lead screening, where they live, have they ever tested positive for lead before. So this is another way as a nurse practitioner we can help prevent environmental risk factors